standing on the existing protocol. My name is Bassey. I'm final year medical student from the Department of Community Medicine, Faculty of Clinical Sciences, University of Calabar. I'm here to present a research work titled Knowledge, Perception, and Acceptability of Human Papilloma Virus Vaccination among Secondary School Teachers in Calabar Municipality, Cross River State. My co-authors are displayed. For the purpose of this presentation, I'll be using the following outline. For introduction, as a word of introduction, I would love to say that globally, human papilloma virus infection has been identified as the commonest sexually transmitted infection in men and women, and it is well established that cervical cancer is predominantly caused by the persistent human papilloma virus infection of the cervical cells. Cervical cancer is the fourth most common cancer in women globally, with around 660,000 new cases and 350,000 deaths. Sadly, 94% of this death has been seen to occur in the developing countries like Nigeria. Mortality associated with cervical cancer is in low and middle income countries, particularly Nigeria, is 3 times the rates found in high income countries. Despite the introduction of effective human papillomavirus vaccines, uptake remains low, especially in Nigeria. Teachers significantly influence students' health behaviors and community health perceptions. Therefore, understanding teachers' knowledge and perceptions can inform educational campaigns targeting both the teachers and the students. This study aimed to determine the knowledge, perception, and acceptability of human papillomavirus vaccination among teachers in secondary schools in Calabar Municipality, Cross River State, Nigeria. This study was carried out in Calabar Municipality, Cross River State, among teachers in selected public and private schools in Calabar Municipality, using a cross-sectional descriptive study design, and all consenting teachers in selected secondary schools were recruited into the study. Our minimum sample size was calculated using the Cochrane's formula, and we had a sample size of 100 with 10% allowance for the non-response. The 100 participants for this study were recruited using the multi-stage sampling method involving 2 stages. Our data collection was conducted using a pre-tested, semi-structured, self-administered questionnaire. And our data analysis was performed using the statistical package of social sciences version 25 with significance set at p-value of 0.05. The knowledge of human papillomavirus was assessed in 4 domains: the knowledge of transmission, knowledge of health problems, knowledge of presentation, and knowledge of prevention. The mean of the total score was calculated, and teachers who scored above the mean were assessed to have good knowledge, and teachers who scored below the mean were assessed to have poor knowledge. We did same for perception. Ethical approval was sought and obtained from the Health Research and Ethics Committee of the University of Calabar Teaching Hospital, and permission was obtained from the management of selected schools. For our results, the mean age of study participants was 41.66 plus or minus 9.09 years, with more of the respondents within the age 40 to 49 age group. Majority of the respondents were females and were married. Most of the respondents had attained postgraduate level of education. Our respondents, 89% of our respondents were aware of human papillomavirus, and the commonest source of information was the health workers. More than half of our respondents were assessed to have good knowledge of human papillomavirus vaccination, and more than half of our respondents were also assessed to have good perception of human papillomavirus vaccination. 75% were willing to vaccinate their adolescent female children, and 25% were unwilling. Doctors' recommendation and school requirements, amongst others, were the commonest respondents perceived facilitators of vaccine uptake, and concerns about vaccine safety, lack of adequate information on vaccine, were respondent perceived barriers to vaccine uptake. Here in the table, the factors found to be statistically associated with poor knowledge of human papillomavirus vaccination among our respondents were years of experience and subject thoughts, such that teachers who had more than 10 years of teaching experience were seen to have poor knowledge compared to teachers who had less than 10 years of teaching experience. And then teachers who taught teachers who taught subjects other than health-related subjects were seen to have poor knowledge compared to teachers who taught health-related subjects. In conclusion, I would love to say that this study demonstrates a significant level of awareness regarding human papillomavirus vaccination, with majority of our respondents exhibiting good knowledge and majority showing positive perceptions. Notably, majority of participants were willing to vaccinate their adolescent children. Respondents perceived facilitators of vaccine uptake were doctors' recommendation and school requirements, and key factors associated with poor knowledge of human papillomavirus vaccination were years of teaching experience and subject taught by the teachers. These findings underscore the need to launch campaigns targeting teachers, especially those with more than 10 years of teaching experience, to highlight the importance of human papillomavirus vaccination and address teachers' concerns on vaccine safety. Here are some of my references, and at this point, I would love to thank everyone for listening. Thank you.
Thank you.